Okay, well, we are recording and it is 12 and 1 minute, according to my watch at least, here in Israel, 10 a.m. in the UK. And we are very happy to have you with us at this discussion on a somewhat maybe unlikely topic in these days, at least for the Israelis, but I would like to extend a very warm welcome to you all to this policy discussion on circular economy in the food service sector, perspectives from Israel and UK hospitals. This event is an event that was catalyzed by the research that was made possible by a generous grant from the Wohl Clean Growth Alliance. The Wohl Alliance is a wonderful initiative that is led by the British Council, which aims to promote collaborations between British and Israeli researchers working on sustainable development and green growth. I would like to extend a warm thanks to Mrs. Iris Brenner, which I have just seen that she's entered the room, so I'm happy you're here with us, Iris. The British Council and British Embassy teams who have worked tirelessly to support the Wohl Alliance, as well as many other collaboration efforts. So thank you so much for joining us and making this possible. Professor Manoj Dora from Angelia Ruskin University and myself were fortunate to receive the Wohl grant, which allowed us to embark on the unlikely journey of trying to decipher or entangle the policy landscape around the underexplored, dare I say, under the radar topic of food waste in hospitals. Globally, food waste is an enduring problem with not only environmentally disastrous consequences, but it is economically unsound and socially immoral. I would personally say even repugnant. So food waste in different sectors has obviously varying causes across the supply chain. We chose to focus our attentions on food waste in hospitals and more broadly, I would say in service organizations, but in hospitals in particular. And that hopefully will help us shed light on some of the broader challenges and barriers to reducing food waste in food service organizations. However, of course, extracting general lessons from this very particular sector that we have focused on, namely hospitals, should be done with caution. What we aim today to do, at the minimum, is to bring to you the initial findings of our research. And we would then briefly also elaborate on our methodology, but we will start with a presentation of the way we perceive the role of circular economy in food supply chains. And I will pass on the podium in a moment, the virtual podium, to my dear friend and colleague, Professor Manoj Dora, to do that. After we present our part in the matter, we will call upon Dr. Orit Afumado-Yona, the director of the nutritional department in the Israeli Ministry of Health, to comment and respond. And we do have with us today also Kevin Garrett, local lead at the UK National Health Service, or as it is known, the NHS. We will leave ample time, hopefully, for questions and discussions led by Dr. Michal Bitterman. And thank you, Michal, for agreeing to serve as the lead discussant. I can not conclude without thanking Dr. Tal Golan and Sydney Levet, which have worked with us on this project. Finally, on a personal note, this meeting comes in the midst of what I would say, and probably most of my Israeli compatriots, as the darkest and most stressful period in the recollected history of Israelis and Palestinians alike. Following the horrible shock of the October 7th attack and its deadly aftermath, with yet 133 men and women and children still held hostage in Gaza as we speak, it has been extremely challenging as an Israeli researcher to continue on. And we've faced growing global calls for boycott and severing ties. So I would say this is in no way an event, and for me, a cooperation which could be underestimated. And so I'm very highly thankful for the fact that we were able to continue this research and hopefully contribute to the betterment of our society in these even very dark days. So I hope that our presence here today is at least a statement to the resilience and dedication of to our work and the importance in which we perceive it. So thank you so much. And Minaj, over to you.
Thank you very much, Wohl. And I also welcome everyone as well to this event. And it's very interesting. Just before I share my slide, if we started this initiative, I remember, when British Council first organized an event to visit Israel and meet researchers across Israel. We went to different universities, and that's where I met Or in the British Council, British Ambassador's house. And that's where we initiated this idea how we could work together from her policy perspective and from my side to the food supply chain and wastage. So that's where we started our collaboration. So what I try to do in this presentation is that to give an overview of what really the overarching theme of food waste and circular economy. So before doing that, let's do a small test. If you could put in the chart box this answer to this question, what do you think the percentage of food wasted of all food produced in the world? Is it A, 11%, B, 22%, C, 33%, D, 44%? Please put in your chart what is the right answer. Great. So according to FAO, the right answer is, it definitely varies, but right answer is 33%. So if you buy 3 bananas, one you throw away, one you straight away throw. So that is first. The second question is, which region do you think wastes the most food? Europe, Southeast Asia, Sub-Saharan Africa, Latin America? So right answer here is B. but there's a second closest is Europe. There is also, but the interesting thing is that in the Asia or African America, Latin America, the most food wasted in the post-harvest scenarios. But in Europe, in more developed countries, the food is wasted more at the consumer level. So that's a big difference between where food really wasted. Right? Last one is again related to food. The percentage of people overweight or obese in Europe. So it's a bit shocking because there is no answer coming right. This is D. So 50% of the population in Europe either overweight or obese. So why did I really put these questions? And just to get to know that how our food system really works and how broken our food system is and how we consume, how we produce, how we distribute food shows from this very, very basic statistics. So on this backdrop, it's not that we are not producing enough food. So we actually, the per capita availability of food, that is 2,770 kilocalorie per person per day. And we are producing way more than that. But in the same place, the statistics could be very interesting that 1 in 9 people in the world go to bed either eating less or no food. So 1 in 9 people in the world is food insecure, whereas we have enough food available. So what is the problem then? We have enough food, but food is not reaching to the people. It is about how do we really govern the food, what policy we have, what logistics we have, how our supply chain is arranged, organized. So there is no lack of food per se, but it is not reaching to the right people in the right time with the right price, right? And right quantity. So that is the whole synopsis of this whole particular workshop. How do we create a circular economy system in the food sector so that it reaches the right nutrition to the right people, right? So with this background, I just would like to start with this. Really bothered me. What is the problem? So we started looking at where really food being wasted. What are the hotspots? So I looked at literature and reviewed 2014, 2218 literature to find the 24 most specific one to understand where are the hotspot of food waste at the primary production level, the processing level, the storage level, and food services consumption level. And what are the main causes of food wastage? Then I went further, and that was very interesting. This is a picture from one of the fascinating restaurant in Belgium, where I did my PhD in Belgium, and that's a unique country with highest density of star restaurants. So food is beautiful when they present in front of you. But I had also opportunity to look the food from the what happens behind the door, how our food is being processed. So now I will take you through those companies, those food processors, how is food processed. So I went to 47 different food processing companies, which is published later on, and looked at how food is being processed. I interviewed people, I observed how things were, I talked to managers, employee, all the different kind of food products. And then I'll take you through how it really looked like, right? So we did this methodology. It's called value stream mapping methodology, which we adopted from Toyota production system. So how Toyota find values in each stages of production process and how we identify the amount of food wasted. And in this process, we look at this is from a famous bakery, tons and tons of breads are thrown away every single day. Why? You and me do not like the side parts of the bread, all going to the landfill. Look at this is delicious Belgian chocolates, but the picture is taken in a bin. It's going to be thrown away. Why? It did not match the specification of the supermarket. It is slightly harder, so that's why they have to throw it away. This is the drinks, energy drinks from a company. It's all going to be thrown away. Reason? There is a wrong labeling, no wrong labels on these drinks. This is another one of the largest fruits and vegetable company in the world, and a simple estimation of all the spillage you see. We did a basic calculations, and it is 842,000 euro per year they are throwing away. One company. Just you could think of, and just think of the magnitude of the food waste in the country or the global level, how we are throwing away food. This is another picture of a company. The manager is showing me away how they operate, and all the salads are on the floor. So these are some of the pictures give us a perspective how our food is being processed. This is from a bakery, tons and tons of dough. Just because of wrong ingredient, it is going to be going to the landfill. So this is a sausage making company. In a year, they were, they could save fourth of a Ferrari if they take one simple, tool. We did one very interesting, just €5 worth of this board, Q board we use in the work floor, which demonstrate the quality, and each of these spikes represents the day of production. And if the company put the wastage level less than 4%, they make it green. If more than 4%, then this is red. In the beginning, the whole chart was red because it's a very high level of, but the day this visual map is in front of in the work floor, immediately it started working with the employee and how they take care of this product and how every possible measures the employees could do that the food waste become dramatically low, and they could save a Ferrari every year because of this particular one. If you spend just £5 here and make it visual, and that has a remarkable impact for the company. So this is all the perspective I gave. But then I also want to see how geographically it is different from the developed country to the developing countries. So this is a picture from Uganda, and we are walking through. It's very interesting. The bananas, which were not the farmers not able to sell it because of the transportation issues and others, and there's no proper market, so there's too much production. So there's enormous amount of bananas being wasted. And I'll show you with a case study what we did, what that banana without how that banana could be used so that this local community can get the best benefit. So this is another very interesting aspect. So I would like to show you later part as well. But also another very interesting anecdotes I could think of is this particular place. They also have a very nice chilled refrigerator where they can easily sell the Coca-Cola. So Coca-Cola could reach each and every corner and you can get it chilled. But we have difficulty sending the fresh fruits in the right way, so that, and then that we have to be thrown away. So what Coca-Cola does differently than all the resources we have, and we can't really make use of our product count. So I looked at the reason of the root cause of the food loss in developing countries and low developed countries. And we again went for what are the main reasons at the manufacturing level, at the farm level, consumption level, hospitality, and distribution level. So these are all the regions from the developed country scenarios. But think of the developing country. This is a fishbone diagram. Developing country, developed country have so many regions, and because there are more studies, so we understand these phenomena better in the developed country. However, in developing countries, we have so little information what's really happening. So that's why this fishbone diagram is a bit smaller than the developed country context. So that what we can learn from this is that there is a real need for research in low income country or low developed countries to understand what are the main reasons of food wastage. So we also looked at different mitigation strategy, and because we are trying to get towards a bigger solutions. So all the public awareness, donations, training, livestock feed, all these elements are came out from the literature. So next is one thing quite clear that we all follow a linear model in the food supply chain. We take resources, we make something out of it, we use and we dispose. This is the traditional and age-old model we have been following, each of our industry and everything. So that's why we have so high amount of wastage, losses. We take, make, use, and dispose. But that's exactly what we need to move away from. How do we create a system where we'll have zero wastage, right? So we are now looking at the zero wastage scenario. So this is the circular economy model. How do we reuse, reduce, recycle, and recover in the whole supply chain, either through charity, animal feed, anaerobic digestion, fertilizers, all those elements, how we can do that, we will reach to the zero wastage vision. So there should not be any particles should be going to the landfill. So I will not take too long just to show you. I have some more studies, but I will straight away take you to some of the case study or the changes we made. So these are some of the research we have done, but because of the time, I'll not take it explain. But look at these different examples. All those side parts of the bread is now a company came and they make toast beer. So it's an excellent example of instead of throwing to the leftover food to the landfill, how it could be reused and marketed. A lot of fruits and vegetables, fresh food is now being used as anaerobic digestions. This is a very interesting case we did in Turkey. They are olives. Olive oil, after making the olive oil, all the side, the skin of the olive oil, olives, the fruit was thrown away earlier. But a new entrepreneur, they started making soaps, the hand washing soaps from this the skin of the, so there is absolute zero wastage. So you have the oil and you have the soap. Similarly, I explained to you about the bananas in Uganda. And during the COVID time, we started this because farmers could not take it to the market. There is no transportations. So what local community women did is they collect all this banana, they ferment this banana, and then make banana wine, red sweet wine, and it's increased their livelihood. It's their income, livelihood, just because turning wastage into wealth. So banana is no longer being wasted there, and so you make wine out of it. So these are some of the excellent example of how food could be turned into, food waste could be turned into. But the one critical element we learned from all these case studies, it needs really a multidisciplinary, all stakeholders engagement. It's not just a farmer, consumer, or NGO can do, but we need to work together with industry, researcher, and government to solve such a critical problem. With this, I would like to thank you all again, and maybe, or would you like questions now or later?
I think we'll leave questions to the discussion.
Yeah.
Okay. So I'll try to share my screen now. Okay. Okay, so picking up from the broad introduction, thank you so much, Manoj, and so many incredible projects. And now trying to dive into our very specific topic with a specific area, which is the food services and specifically hospital or subsector. And obviously, I mean, if we wanted to start from looking at the data. And unfortunately, the picture of the data is quite bleak, both in Israel and in the UK. We do have reports, interestingly enough, by two non-governmental institutions. In the UK, that would be WRAP, which is an NGO, today a global NGO working on food waste and other issues of climate change. And in Israel, the source is Leket Israel Reports. So again, an NGO that works together with government. In the UK, the definition of the sector is a little bit broader than in Israeli reports, but basically there's quite a similar definition in both Israel and in the UK when looking at food services. So we wanted to check how much do food services contribute to waste in both countries, how much waste is produced per capita for food services, and how much waste is produced by hospitals. So first off, we needed data on food services. And when you look at the definition for food services is quite broad, and it includes all of the outlets that serve food or drinks in an out-of-home setting in the UK, which includes obviously not only healthcare, which includes a subsector of hospitals and nursing homes, but staff catering, as well as profit organizations such as restaurants and hotels. In Israel, they differentiate event venues from restaurants and hotels, and they don't have any reference to prisons. But other than that, basically in Israel, the sector is called institutional consumption or institutional waste, whereas in the UK, it's defined as food services and hospitality. And when trying to look at both the quality of data and the continuity of data, unfortunately, again, the picture is quite bleak, as I said. In the UK, we have very limited data points specifically for hospitals, which are all based on an initial estimate that was made in 2013 and has not really been updated since then. In Israel, we do have more data points for hospital, and they are based on a model extrapolating from the number of meals served at hospitals. So when I do show you in a minute the results, you'll see that it's a little bit difficult to compare, but we do have some comparison points. So just to have a general overview, first of all, with the comparison or relation of how much waste is produced by households. So again, this is a totally different sector, but households in the UK and Israel, what is interesting here is you see the widening of the gap. So if in 2018, basically Israel and the UK were at almost the same point of 100 kilograms per person of food waste per year, the gap has only widened since then. And basically in the last data that we have, which is 2022, the gap has been the widest. So Israel has grown by 5% to 105. And actually in the UK, a similar decrease was made. So the gap is now 10 kilograms, which is quite significant. And if the trajectory continues, then the UK will be in a much better place than Israel is today in a very short span of time. Now, zooming in to food service and hospitality, or as it's called in Israel, institutional waste, what we see here basically is that in the UK, and very surprisingly, since you would think that, for example, hotels or restaurants are much larger sectors in that country, you still see that food waste in Israel in the institutional sector is much higher per capita and has always been. And the only low point really has been COVID 2020, where institutional sector was not as active. Obviously, people were under curfew at home and weren't eating outside as much, or weren't as much in the work of places of work. But other than that, there is a minor decrease, so not extremely happy, but we do see an increase in the UK for that. So the gap might be contrary to the household, actually in the institutional sector, the gap might be going in the reverse mode, although it's still to be seen. And now to the specific data we do have on hospitals, which, as I said, is model data. It's not based on surveys or any type of very continuous monitoring. And we do have 3 data points for the UK and Israel where we're able to compare. And we do find a really huge gap. And what is interesting, I think, is to look at the right side here, where we compare food waste per meal in kilograms. So this is, in Israel, what we see is we're standing around almost a fourth of a kilogram, so 250 grams per meal are wasted. And in the UK, the figure is much, much lower. So a little over 1. And as you see, it's stagnant because there hasn't been a re-estimation since 2013 or 2012. So this is where we are at. So the general, I would say, overarching view, maybe to summarize just for the UK, is in household waste, there is a constant decrease, and the gap is growing wider, whereas in the institutional sector, it's a little bit more of a mixed picture. But in hospitals, it's very clear that Israel still has a long way to go in terms of reducing the footprint of waste. Now, what did we do? So we tried to look at how policy affects all of this. And obviously, institutions work within policy frameworks or policy setting, which highly impact their operations. And what we try to do is classify the types of policies that exist with regards to supply chain around hospitals. And this is the model we used. So we used a basic supply chain model, but looked at whether really the supply closes and the circular economy can be achieved through the crucial stage of reuse and recycling. And just a few examples of the type of policies we were looking for. So, for example, with procurement, okay, obviously hospitals don't grow food, but they do procure food, and they could be affected by policies that demand certified low carbon or low waste producers, or, for example, by reducing animal products and increasing low carbon options. Transport and storage, there could be, I mean, if we control transport conditions, we could reduce waste through improving the longevity of food, and optimizing storage conditions, again, would contribute to the same effect. And I think that was shown by some of the work done by Manoj in developing countries, but also it is very relevant to developed countries, obviously. And we looked at that. So for preparation, there are different issues, and we'll discuss them in a moment. But for example, controlling sanitation to reduce contamination could affect or prepare to order could reduce, if we're prepared to order, we could reduce potentially food waste. In consumption, allowing choice variation, I will address that because that is a tricky issue. And obviously, again, a very contentious issue could be allowing human reuse of untouched or still packaged food, even in hospitals. And we'll see that in Israel, that is a main challenge and barrier. For waste collection, we looked at policies that required collection of separate collection or separate designated areas for organic food and waste. But obviously, separation of organic and non-organic waste at the source could highly contribute to then the options for reuse and recycling of that organic waste, food waste. And finally, reuse and recycling. These are just a few examples, but taxing landfilling, which is a governmental effort that could obviously spill over to create incentives for better separation and diverting food waste that is created to recycling. So basically, that's the framework. And this is the policy picture or the policy diagram from what we have in Israel. And I will go through the different stages in a moment. So what we see in the outer circle is policies that support circular economy and what stages within the supply chain they are related to. And within the inner circle, what we see are policies that actually create barriers. So this is very interesting. As you see, we have 6 major policies that create actually barriers to having a more circular food economy within hospitals. And most of those barriers have to do with food preparation, which I will discuss, but also with waste separation and treatment. So we have 2 major policies that create barriers for waste separation and treatment within hospitals. And which is interesting because what we see is that within procurement, for example, or storage, or consumption, or reuse and recycling, thankfully, we don't have any policy barriers. So at least that's a good sign or good news, but we still have these barriers that we need to think about more thoroughly. So what kind of policies do we have that are related to procurement? In Israel, we have general regulations and standards concerning labeling and packaging of food. And obviously, that affects procurement in hospitals because it guides nutritionists, hospital and dietitians to procure based on nutritional data, and which helps reduce procurement of low nutrition food and then allow for preparation of healthier food. But it also allows for the basis of certification by the Ministry of Health of food suppliers. And what we see is that there is regulation that requires hospitals only to procure food from recognized health food suppliers, which obviously reduces the risk of unsafe supplies, which is a very good thing. But those requirements for certification don't include currently any requirements for low carbon or low waste suppliers. So this is an opportunity for policy, for example, to include such requirements, and then through procurement, we could achieve a lot of prevention of food waste by procuring from suppliers which stress and have policies for reducing food waste at the supply stage. And we saw examples of quite bad practitioners in Minaj's previous presentation. Policies relating to transport and storage, we really only have one significant policy which affects hospitals that has to do with the storage and the transport conditions for sensitive foods, which is a good thing because we have quite regulated conditions for that, which means that we are going to reduce food loss in transport. And however, again, there are no requirements within this policy for low carbon transport. So again, this could be an opportunity for not only contributing to reducing food waste, but also contributing to a more circular economy in terms of climate protection. With food preparation is a very highly regulated activity within hospitals in Israel. By the way, I haven't mentioned this, but you see all the names of the different regulations that we have on this issue. And the issue is highly regulated and has quite a few goals in the policy itself. So the goals include ensuring hygiene and safety, providing healthy and patient-suitable meals for supporting recovery. I think this is extremely important. And we do see that menus have to be approved by a dietitian. I'm sure we'll hear more about this from Dr. Yona. Substantially reducing the minimum of processed foods and ultra-processed foods, again, which is good news in terms of food waste, because if we're using more primary products, we will have less wastage most probably. But unfortunately, again, red meat is not reduced and is not eliminated, but could be reduced through these guidelines. And the last aim is really, and this is a regulated aim again, is increasing choice or providing patients with different choice possibilities for meals, including vegetarian and vegan options, which initially could create more waste because we have several types of meals that need to be prepared and not always based on perfect data on demand. And that has the potential, again, on the one hand, to increase waste, but on the other hand, we see that policy, because it wants to match preferences or come as close as possible, we would provide patients with more choice and something that is more suitable through their tastes. So again, this is kind of a double-edged sword, and it is a little bit difficult to know how the policy really affects food waste. Now, for consumption, we don't have any binding regulation. And what we do have are dietary requirements. So basically, this is an unregulated stage of the supply chain. And there is options for thought of what we could do here, and maybe we'll open that for the discussion later on. Waste separation and collection in Israel is a real conundrum. And as you can see, food waste needs to be separated from other types of waste, especially hazardous and medical waste. And this is for sanitary and health-related issues. However, separate collection requirements don't entail the separation of food from packaging. So really, in that sense, we're not improving or creating possibilities for more recycling of food later on. And unfortunately, there's also no mandatory or voluntary policy on the general reduction of waste. So we have here this picture of where there's a lot of effort put into separation on the one hand, but that separation isn't, I would say, generally used to improve recycling. And finally, I think this is probably the most disappointing of stages, and again, the most crucial for circular economy, specifically in hospitals. In Israel, we don't have any mandatory policies requiring recycling of food or organic waste. And at the same time, food hygiene regulations prevent the reuse of waste that was left or that has left the central kitchens in hospitals. So basically, all food that has come to the wards, and even though it was untouched, has to be thrown away. And although a regulatory framework exists to support food donations, the specific food from hospitals, again, cannot be donated. So again, there's this paradox within the policy and an internal conflict, but basically that is the situation that the current policy creates. And if we look at economic instruments, then, as I said, there is a landfill tax in Israel, but it doesn't provide sufficient incentive currently for recycling of organic waste, and we don't have any financial instruments to support better separation and recycling and composting. So that is the extent of the picture, and I should probably stop sharing my presentation, and Manoj, now to you, so you can share with us the little bit more optimistic policy environment of the UK on this issue.
I'm not that sure, or if it is more optimistic, but I'll certainly share a few. I don't think we have too much time, but I'll briefly go through some of the policies in place and what are supportive and barriers to food waste and circular economy. So just to start with, also I must thank Sydney, who worked with me on this project and prepared the presentation. So in terms of legislative, so also thanks Wohl for bringing that and leading us from the policy framework. That is her strength, and we based on that framework, we try to collect all the mapped all the policy documents in UK and in Israel. So in terms of legislative framework, we have some of the are very up to date, like Environment Act, where they prioritize the resources. We have regulations, and besides that, there is another very interesting element came 4 years back. UK is the first country to come up with a roadmap for zero food waste. So where they bring together all the different stakeholders, but not very particularly for the NHS as such. It is in general. So this particular work is specific to the healthcare and NHS, and what policy framework is towards allotted to that. So this is legislative framework came up. And then another element from the model which Wohl presented to you and just before, the procurement, which is quite critical. And we have last year came up with the NHS zero net zero supplier roadmap. So how your procurement might help us to reduce the food wastage. And because every NHS has to now submit the net zero emission targets and their achievements very regularly. So that is also one of the very, very interesting element which is now in place. In terms of transport and storage as well, we have East London NHS Foundation Trust 2018 food safety and hygiene policy. They put like they require refrigerator to be capable of operating under the 5 degrees centigrade, and food must be date coded, and those are the few critical elements influenced by research. So research-based policy making is in place. So the next one is the food preparation and production as well. And there are regulations on, and that is mostly coming from the EU legislation. And besides that, the British Diabetic Association and Nutrition came up with the guidelines in terms of how the food should be prepared and produced. In terms of consumption, that is one very critical gap we find here. So no policies we found so far concerning the consumption of food and how circular economy could be identified. So this could be one area we need to look at and we take it forward. In terms of waste separation and collections, there is quite very up-to-date and well-placed policy around what should be the requirement for the businesses, for the hospitals, and how it should be separated. So that is very, very clearly presented. And so again, we here follow the West hierarchy. What should be, which should be disposed, which should be energy recovered, which should be recycled, which should be reused. So this is a complete circular economy model we apply using the West hierarchy. Besides that, we also have this reuse. So we have a policy like landfill tax, which is quite useful and impactful as well. Food reduction fund is there, so there is more incentives based plus taxations and disincentives is also there. So both factors is quite interesting from the UK perspective. So we have Food Safety Act, which is in place for a long time, and there are some latest as well, the NHS National Standard for Healthcare and Food. So that is also new regulations in place as well. So in terms of like comparing what are the supportive policies in terms of, we have procurement, waste separation, and reuse is quite prominent in terms of food waste reduction in the NHS. But some barrier policies are, what we found is mostly the transportation, storage, food preparation, productions, and reuse and recycling. So these are some of the basic policy roadmap we found in analyzing all the policies available in the UK based on Wohl's framework, which she presented in her presentations.
Wow, you did that so quickly. Okay, so I think this is the point where we will hand it over to Dr. Orit Afumado-Yona from the Ministry of Health. Orit, do you want to share a presentation?
Yes, I will share it. There's still the Is it okay? You can see?
Yeah.
Okay. Okay, thank you. Hello, everyone. I'm really happy, and it's a great opportunity to present the part of the work we are doing. And it's really a work that their outcomes showed us that it could do some changes in the food waste and food cost. So I will talk about our work in managing nutrition and food service in hospitals. I'm working in the nutrition division in the public health services in the Ministry of Health, and I'm managing all the area of general hospitals and in the medicine and the nutrition in the community. So about 8 to 10 years ago, we are doing regularly audits in the Ministry of Health, not only in the nutrition area, but many areas. The Ministry of Health is coming to the hospital and doing audits. And one of our findings during the year, about 8, 10 years ago, we collected all the data from the audits from the medical institution, and we find out that patients do not always receive food which meets their nutritional and medical needs. Communication between the food service and the hospital wards was lacking. Very little or even lacking. No nutritional supervision over the food chain. I meaning all the food chain, from the point that supervise what the food we are buying, all the way it's preparing, storage, and giving it to the patient, patient or staff. So this led to the conclusion that there is no nutrition sequence. When we started the work, when we find this data, our vision and goals were first because care and sustainability, improved of food intake as part of the patient treatment and recovery because we found out that many of the patients don't eat the food that they received from the food service. So one of the goals, and we wanted that the patient will eat. So this is part of the nutrition and the recovery process and reduction of food waste. The steps were a very long procedure. I mean, it took time. First, it's a new occupational role that is called food service dietitian. I mean, it's new in Israel, but it's well known in the US, in the United States, some of Europe countries. But in Israel, it was quite new. It was developed and defined in the Ministry of Health and the Civil Service Commission. We made a case study through the years 2014 and 2017, which we examined the 9 hospitals that employed a food service dietitian. This was the intervention group, and 9 hospitals without employee of food service dietitian. We also update the directive. We have a food basket directive that we, regarding all the nutrition that patients should receive, not only one menu, but to do an adaptation to the nutritional needs of every ward. And also in the directive, we define the role of the food service dietitian. Another thing was special training course to train dietitian for this role. It was an essential training for working in this role, was developed to train this dietitian, because when we are studying in the university, we don't study this issue. Sorry, there are some things. The impact of the food service dietitian was assessed according to the following parameters: training of food service staff in current nutrition guideline for hospitalized person, nutritional analysis. Before we established and entered this role, there was non-nutritional analysis. I mean, there was very few, and we have to analyze what the patient is receiving. Night meals were served to the patient as required by the Ministry of Health Administration Directive, and food cost saving and food waste reduction were calculated. I mean, this is the four main parameters that we saw because of the work of the food service dietitian. Just a minute, it doesn't move. Oh, okay. The next thing was nutritional characterization of patient needs by food service dietitian. That include the following aspects: adjusting menus to suit patients' medical and nutritional status. Before the work, there was very little or none of this subject to suit the patient medical and nutrition status. Serving a variety of fresh and cooked foods with high nutritional value. The dietitian supervise all the food chain before buying all the materials. Before buying the foods, they have to check it and confirm it that the kitchen is allowed to buy it. along with restriction of serving processed and ultra-processed food. This is one of the demands of the food basket of the directive. So they are not allowed to serve these foods. Ensuring the menus for patients with allergic and food sensitivities, such as celiac disease, will be approved by the food service dietitian. Before the food service dietitian entered the hospitals, the kitchen and the food service received from the wards a list of diets that they need for the patient. High calorie, high protein, low sodium, celiac. The kitchen received it, but there was no one professional one that could do the intervention and the theory to translate it to food. So it took a time. I mean, it wasn't so fast to enter to this role to the hospitals. It took a lot of time to convince the management of the hospitals. In 2020, we published this article based on the case study, improved meal service and reduced food waste and cost in medical institutions resulting from employment of a food service dietitian. It was a very important publication because it was a very important part to convince the hospital's managers. Here we see the 9 hospitals that employ food service dietitian. We can see that they achieving the implementation of this parameter in the orange, saving food costs, saving serving a late night steak for all patients, nutritional analyze menu. There were a few hospitals with no food service that did it, but most of the hospitals with food service did it, and conducting ongoing training of kitchen staff. It's very important to do. We found it in the audits and visiting the hospital. It's very, very important to do this all the time to do ongoing training of kitchen staff. This was special development or special application or computerized interface when we connected the medical records in the ward to the food service. At the beginning, when we did the case study, there were only 7 hospitals. Today, almost all of the general hospitals have this, and we require it as a demand in the audits. When we are doing audits from the Ministry of Health, it's a requirement. This was only at the beginning, at the case study, but before doing this application, this interface, a patient that received enteral nutrition and parenteral nutrition received a meal, a regular meal. When this meal, because this is, patient that can't eat regular food, this food was thrown away. So this is the amount, this is the amount saving money only in 7 hospitals and only for this patient. Today, it is an online computerized interface that is that patient that can't eat, that were released home, or any other reason that can't receive food, a regular food, they don't receive it. So it doesn't send from the kitchen. It is saving at advance. So this is the amount saving. Also, there are cost saving that are saving also that resulted reduce food waste from things that this is part of their jobs of the food service dietitian, like adjustment of orders of food such as bread, milk products, all of this. When they do the adjustment of the amounts, it saved money. Adjustment of protein size. Before they came to the food service, there was a lot of food waste in protein. They gave a large size of protein size. It was the patient couldn't eat it and it was thrown away. Also, switching from centralized serving to personal trays, also saving money. This is one example from one hospital. So if I will conclude our achievement, first, translation of the medical and nutrition needs into food preparation, the patient at the center and improving the patient experience, cost saving, most of them from reduction of food waste and to order just food and the amount of food that patients need. A model that can be expanded and implanted in any medical institution and catering company. And there is now a nutritional treatment sequence. Today, we have almost about 50 food service dietitians in general hospitals, and the 4 sessions of special training course have already been completed. Now, it's not enough. We have to do a lot of work, and a regulation that will include all the areas, not only the nutrition. But we have an existed infrastructure, first a computerized interface between the medical records in the inpatient ward and the food service. And we have also about 50 food service that we are seeing now in the audits. That is a very great improvement. Nowadays, I mean, about 3 months ago, a committee of the Ministry of Health was established to deal with the issue of green hospitals with the participation of representatives from most organizations and medical institutions. The next step we want to do is promote a process to reduce the choice of animal food, because we have now all the things, we have the computerized interface. Now there is, the patient can choose their meal through tablets or video screen. Each patient can choose through a computerized application that is connected to the medical record, so that it will be possible to do each patient with his nutritional and medical needs, but to reduce choosing food, meat, and choose more vegetarian, more plant food than the food like chicken and meat. Also, we want to do a training for multi-professional teams and employee in food system on food and nutrition and the relation to climate and environment and sustainability and more. Because we came to the conclusion that dietitian, the workers in the food service, there isn't enough knowledge and awareness about this subject. They don't know it enough. Even the most professional don't know it, and we have to teach everyone. We do also have to do regulation, but the regulation only in nutrition is not enough. We have to expand it to all the areas, all the things that are connected to these things of environment and stability and food waste. And this is some of it we implemented. We think that hospital is an educational opportunity where therefore is an excellent platform to changing behavior and promoting a healthy and sustainable nutrition among the hospitalized patient and also among the staff, and a regulation that promotes, we have already this regulation, the food basket, and also regulation for the sale of healthy food and drinks. We have the regulation of employee of food service dietitian and our audits. So we can expand and do the audits also in these subjects of food waste and sustainability, but it's not yet established, and this is the purpose of the Committee of Green Hospitals. And also all the procurement of green procurement to do it, establishing a community vegetable garden in hospitals, and also hospital promote breastfeeding. So we are looking all of the things that could bring us to healthy food environment, to do more vegetable and fruit markets from local farmers in the hospitals, and also to expose them to healthy and sustainable nutrition. And to fully equip the hospital area with water coolers. So we did a lot of work in the 8-10 years in regulation of nutrition and the food service, and to do the adjustment between the nutritional and medical needs for each patient, and to do some of the food waste to reduce, but very little. Still, there is a lot of work to do. And we hope with the large committee, we can do it and to expand the regulation to all of the areas. Thank you.
Thank you so much, Dr. Rita Fumadoyona. A really
Thank you.
inspiring, detailed talk. And I think you have the very charted map in front of you how to proceed. And we are happy to support you in any way possible. So thank you so much for that. We have Mr. Kevin Gerard here with us from the NHS. Thank you, Kevin, for joining us. So in the original invitation, you have a slot now for your presentation. However, it's up to you if you want to use that, or if you'd like us to continue immediately to the discussion.
Can you continue, please? I was really quite clear that the NHS Foundation Trust that I represent, we're at the beginning of our journey around food. So yeah, I'm here to gather information as much as anything else, but thank you for the invite.
Well, thank you for being here with us. So Michal, it's over to you to lead the discussion. Thank you.
Thank you. Hello, colleagues from around the world. As we gather today in this virtual space to delve into the realm of academia and explore the frontiers of research, I extend to each of you a heartfelt welcome. Before we embark our discussion, I would like to first take a moment to express my gratitude. Gratitude to our presenters, Dr. Or Karasin and Professor Manaj Dora. Thank you for sharing their valuable research with us. And Dr. Yona, your work was really inspiring. You know, you reminded me of my hospital days after my second son's birth. And despite being a vegetarian, I received meat meals daily, leading to trays of wasted food. So thank you for inspiring hope that you gave me now. And also to each of you for your unwavering support and engagement. So before we start, allow me to share a glimpse of why I'm here and why Or has invited me to speak today. My own.
And the next one under risk assessment was around.
One second. Do you hear? Or can you hear? I hear a lot of noises in the background.
Where is the changes and where is the changes? So I've just met with Barney on this. So a lot of the
Okay, I think now it's better. Thank you. So I will share a glimpse of my own journey, as my expertise is in sustainability, working deeply in food waste. As the co-founder and CEO of the Natural Step Israel, for the last over a decade, we have delved into working on food waste issues. And we started working on food waste issues in order to really promote the resiliency of our food system, understanding that food waste is a crucial element in strengthening the resilience of our system. And what we've been doing since 2013, we practically wanted to understand the problem, and we took all the different stakeholders from the whole and over supply chain, and we did what we call the Sustainability Transition Lab. And we sat for 2 years in order to understand the problem of food waste and really understanding the market failures, the different interests of the different stakeholders in this really difficult and really complex food chain. And after 2 years of sitting together, we felt that we understood the problem and the different channels to work. And since then, we are every day really tirelessly trying to promote different channels, whether it is the lack of awareness and raising the awareness, providing different solutions to the market and alternatives, how to reduce the food waste, promoting national and local policies, and of course, different channels of operation that could be relevant in the field. And I can say that we were able to initiate the National Day, and this year we have noted it for the 6th times. It's already, it's always on the 12th of March. It's a national week noted on the 12th of March as the National Day, and really aimed to focus the attention and talk about the different alternatives and food waste on the household and us as consumers. We worked very closely in promoting national policy and dedicated to raising awareness on these issues. A lot of work through nurturing the startup ecosystem in order to provide innovative solutions within that. And of course, putting the base of knowledge as in our own research regarding where food waste happens and so on. And I want to say that a lot of our emphasis is on the upstream solutions. So how can we prevent food waste from actually turning out in the end to food that we need to actually save? So our premise is to avoid the immense amount of food that is afterwards seeking its roots in order to be saved. And we still haven't achieved it all, and we haven't succeeded in all. I can give you one example of things that we're fully committed to promoting and still haven't been able to promoting is the dynamic pricing. We're truly committed into putting dynamic pricing in the retail sectors and touching upon our other market failures. And relating to our focus today, one of our key focuses has always been institutional catering, recognizing that it's a major source of food waste. And from the beginning, we did this kind of classification between high-tech catering, aviation, education, and healthcare. And speaking of healthcare, I'm particularly grateful for this research presented today because Dr. Or and Professor Manaj, it sheds light on a critical gap in our understanding of food waste within hospitals. And as Dr. Orit Yona, you have also expressed hospitals are a unique set of challenges and opportunities. And we believe that there are immense potential for aligning positive outcomes such as environmental sustainability, economic benefits, nutritious, and of course, patient recovery, which is very important. So I'm sure this study will undoubtedly leverage invaluable information to drive meaningful change. And now, as we delve into our discussion, I implore each of you to share your insights, questions, reflections on the research presented. And please, the floor is now open, and I would encourage you to open the camera to ask different questions to the presenters and also a discussion among us. And for those who don't want to open the cameras, I can also read your comments at the chat, and I will be happy to introduce it. So the floor is open. Who would like to jump and be the first one? Ronnie.
Yes, hello. Briefly introduce myself. My name is Ronnie Safarov. I'm the environmental consultant in Israel for HS Consulting and just generally a sustainability enthusiast. Thank you very much for presentation. I have a question for regarding the research. Did you pay attention or just did you calculate? Did you research specifically how does the regulation in the field of maybe the religious standards in Israel concerning food, such as kosher laws, impact the food service and the hospitality and food circular economy perspective? Does it somehow play into the picture, or it's not a significant impact? Thank you very much.
Well, thank you for that. Actually, when I was preparing my presentation yesterday, I thought about the issue that I wasn't mentioning kosher laws and as part of both social and even top-down regulation of Israeli hospital food preparation. And the simple answer to your question is no, because the reality is that we don't have, so we know that there are, first of all, there are separate areas in the kitchens. And usually what we've seen is that the kitchens don't mix, but how that affects food waste is an absolute enigma, because we don't have the alternative option of checking when there is no kosher laws. So, but we know that kosher laws in some way also contribute to different storage options and more dedicated storage solutions with regards to temperatures and, of course, cleanliness. So in that sense, we could hypothesize maybe something, but it is very, very difficult to say, and it's a good point. But no, that's definitely an area where I don't have any major insights, unfortunately.
Thank you so much.
Orit, maybe do you have anything to add to that question from the research that you have been doing in the hospital?
The kosher issue is something that I mean, we have to take it in account when we are doing the nutritional decision. There are different, there is also a difference between hospitals in the kosher level, and even between the wards. There are some wards or some patients that require or they're asking a kosher level that is higher. And there are even hospitals that they have kosher levels that because of the kosher level that is very high, there are some products that they will not buy. They will not enter in the hospital because of the kosher limit. And this minimize the foods that we can buy according to the maybe, I don't know, I think maybe you should you will know better if it minimize the foods that I can buy according to any regulation of food waste or something that involve the environment thing. This is a thing that I mean, even it's making the menu either cost a lot of money because of the kosher. Because of the kosher level, they are paying more for the product, and the menu is have a higher cost value.
I will also add, Ronnie, to what you were asking. In general, not only in hospitals, the issue of kosher is a major issue that makes food waste reduction much more complex in Israel, from the overall supply chain and in specific also in terms of the agriculture sector. And I can say that this is something that we're looking closely, but still there is a huge challenge even before reaching that problem. But yes, definitely it is a huge challenge. It's something that makes it much more complicated and much less easy to solve, let's say, in gentle words.
Thank you.
Okay, I see that we have a question in the chat. A question for Orit. How, according to you, reducing food waste can support improvement mental health of population? Thanks, Shmuel. Orit, you're still on mute.
I'm not sure I understand the question. I mean, if food waste can support or improve the mental health, I don't know enough about it because of no, if you could maybe explain what you meant. Maybe I don't understand what you meant by this question. If food waste can support improvement of mental health, maybe in house domain, I don't know in hospitals. I mean, when we're throwing away food, it doesn't do us very well. I mean, in one hand, we are very sorry to throw it away, and we don't know how to minimize it, I think.
Maybe, Shmuel, if you have a more specific question so we can understand it better,
Maybe
that would be better. Yes, this is my question. You understood it correct. Okay, oh, you understood it correct. I can also elaborate on this, that what we have found that it's connected, but not really to what you were asking, that when we start looking at our food in order to minimize food waste, then we're starting to look at food differently. In all, from a general perspective on our food is differently, because one of the major problems is that people do not know and are not aware of the amount of foods that they're wasting. So when they start seeing it, the whole way that they vision the system, and in general, the whole way that we vision the system starts to change. And then we start to communicate different with our food. We start to see more what we are eating and not eating. And it creates a wider change than just reducing our food waste. Our whole perspective of food changes. So I think that in a way, your question is very true, that we found that people are looking more on the quality, looking more on the sources of the food, are more inspired by their food and more conscious about the food when they start to look at what they're wasting. So it's kind of connected also to what you're asking. Manaj, yes.
Sorry, it was muted. I have a question from our own Kevin. I'm really grateful that you could join. You have a very busy schedule, and thank you very much for taking time. And this particular project is about the policy roadmap and what is in, what policy UK has and what policy Israel has, and how we prevent food waste towards making it a zero waste scenario. So we mapped policies, what are existing policies in UK. We presented it before you joined. Israel also presented, or my colleague presented the policies from Israel. I'm just wondering from your perspective, Kevin, because you have experienced all this. So in terms of preventing food waste or managing food waste, what would be what is one or two policies which is very critical from the UK perspective, specifically for the NHS, which is which you could highlight anything around that? I
We
think
can't hear you, Kevin. You are muted.
Yeah, sorry, I want to be really clear. I'm from Mid-South Essex Foundation Trust. We are just one tiny part of an enormous organisation. So I'm not speaking for NHS England
Yeah.
or our Department for Health and Social Care. So I think in summary, if I understand your question correctly, the policy leadership really sits with the NHS Greener Plan, and that's a principal point of reference. The other area that would have an impact on this is our commercial policy arrangements around procurement. So those are the two significant levers that need to be pulled. Both of them are in a significant state of change. So we have a new commercial set of directives, so that will relate to how we're purchasing and procurement food, our food supply, and the other will the kind of greener bit of it again. Actually, when you look at the maps of our overall wastage in the NHS, the component part of which food plays in that, whilst it's important, we have, as an example, our travel time for our business times is the equivalent of 18,500 times around the world. So, in terms of its tonnage that it creates. So, and there's lots of movement in that dynamic. So, particularly around the procurement of pharmaceutical products and equipment. So, I think it's those are the two kind of clear and obvious places, at least in my mind. I think the other thing that I would say, and our serious interest in this in Mid-South Essex, is about the distribution of the food that we might be wasting. So, as an example, whilst it's not quite potentially within the scope of what's been discussed here, our thinking on this is as much about redistribution of what it is that we're wasting in order to stretch the public purse further. So we are in an area which is not too far from London, and we have significant migration out from London for people who retired maybe 20 years ago who are now really in poor health and actually residing in a care home. So can we take what we're not using on an almost daily basis and redistribute that across our whole health and care system? And that's partly because we went through a phase about 18 months ago, just on the other side of the second wave of pandemic, where our care system for elders came perilously close to falling over because some of the macroeconomics involved in how much money you get for an individual, none of that is quite right currently in the UK, and there's no secret about that. We've been trying to fix our care home problems and how we fund older care for many years, and commitments have been made that haven't yet been delivered on in terms of how that's funded. So, and that's not, that's the private personal funding of it as opposed to the collective state effort. So in a sense, that's probably a summary of where I'm at on this current project, is just understanding how much we might be wasting, making sure that we're distributing that to our most needy communities. So my remit and responsibility here is what we call an anchor program. It's an American idea at heart, which we've spent about 5 years anglicizing it here, in the sense of how, as large organizations, so our trust employs 17,000 people, spend something in excess of 1.5 billion pounds. How do we support our communities and our more disadvantaged people, of which we have statistically by UK deprivation measures quite large numbers of, and how as hospitals we are active in that space in order to recirculate the wealth there, shall we say, and I use the word wealth in a careful. So I know that's not quite the answer to the question. It's potentially of interest and underlines some of my interest here.
No, Kevin, this is fantastic. Really, this is incredible insight. Why I'm saying it, before you joined, we presented all the policies, right? And these two were very, procurement and distributions came out very prominently from the UK perspective. So what you say is really, really insightful, and we understand the policy landscape better from this. Um, Another aspect, if I may to add, in terms of the consumption side, we could not find that much of policy guidelines around how consumption can policies around consumption can help us prevent food waste. Is there any insights you could share with us around?
No, but I might well be able to find you our net zero lead in NHS England. I have previously met the individual on one occasion, and I think that might be a really good place to start, because it doesn't all get into the public domain. So I can try to reach back, but no promises, and that we can identify that individual. Yeah, but there is a team, and that again is part of the NHS Greener team. We'll be working on the some of the front end supply pieces. Yeah.
Thank you. Really grateful, Kevin. Thank you.
Oh, yes.
If I may jump in, thank you so much, Kevin. You touched upon a really sensitive issue within Israeli hospital system, which is redistribution. And what we found here is that there is an effective barrier to redistribution because of concerns about microbial contamination of food coming out of hospitals. And so food that comes out of the main kitchen, even though it has not been touched in the wards, has to be thrown away. And I'm wondering whether that is also the case in the UK. And if not, I mean, how have you overcome that? Is that due to some research that you've done to show that, in effect, food doesn't really get contaminated that easily and can be redistributed to those communities in need?
Yeah, I think I don't have any solid evidence at this stage, and as I said at the outset, we are beginning our journey. But that's the reason why we've gone back and looked at it again. That the standardized answer until recently has been, no, we can't do that because of the food consumption risks, and our cost of living crisis is felt to be so substantive here and so long lasting in the UK that it's worth going back and exploring every single evident opportunity we may have. Some of that, I think, has been about confidence in the ongoing supply chain, so that might be safer. So there are a number of, which I'm sure you'll be familiar with, some of them are global, if you like, recycled food app type opportunities. But as an example, our local Kentucky Fried Chicken manages to supply one of our food banks locally with what it is that they've cooked but they haven't sold, and with instructions on how to freeze it and how to reheat it in a safe manner. So our anecdotal view is, well, if Kentucky Fried Chicken can manage to do that, then we should at least be trying to think about what we can do in that space. So, yeah, we're sort of reaching for other levers at this stage to get some serious traction in the issue. But yeah, that has commonly been our understanding. But I think certainly in the UK, we're in a particularly different space at the moment, and it's worth looking under every stone for that type of redistributive approach and seeing how we can see if we can improve that. Yeah.
Thank you so much for that. Yeah, it's really, really important work.
Does anyone else have any question or comment, remark?
So I have a question. My name is Ranan. I'm from the Hebrew University of Jerusalem. For whoever wants to answer. I know that in some Israeli hospitals, there's a good segregation of organic waste. And then in some hospitals, it goes to a reactor and then to the sewage, which is not the optimal treatment. And I don't think that there's a hospital who's using services of a compostation site. So what are the barriers in this sense, and why isn't it possible in Israel?
Maybe I'll take that on. Yes, you're absolutely right. So the anaerobic digestion is currently the only solution to. So first of all, the kitchens that we've seen do have separation. And by the way, separation is, as I mentioned, is part of what policy requires is proper food disposal within hospitals. So organic waste needs to be separated. But that's organic waste that's created in the kitchen, and that is the only organic waste, usually vegetable peels, vegetable leftovers, which are then brought over to the digester. To the anaerobic digester and down the sewage, and obviously potentially also creating an issue for municipal sewage systems for increased organic material within the sewage. And what we found is that they say that the amounts are just too small to justify anything else, and that separating just providing that for compostation doesn't make economic sense for them. So that's what we've heard. While the great amount of waste which occurs from food returning from wards is not separated. So you would find, I don't know if you noticed the picture that I had, but for example, the food that is, the bread that is now brought in plastic bags, or different milk products that have, plastic packaging, that's not separated. And it just then, so there's no real option for composting. And that's a barrier because what they mention is the lack of sufficient, hands on deck, so personnel to do the separation effort within that framework. So within the kitchens, yes, and I think that can be easily solved by small grants given to hospitals to divert the kitchen peelings, kitchen waste, organic waste to compostation, and even used in those wonderful community vegetable gardens Dr. Yona was speaking about. Hopefully that will be not too far not too far in the future. But the challenge is with the food that is left from the wards or left uneaten, and there we have the problem of mixed waste. So that's currently the situation.
But not in all hospitals. In Beilinson, for example, which is a very large hospital, all the food is collected from all the wards and is brought to the reactor. So there's a proper segregation in the entire hospital. But then there's no supplier for taking it forward for compostation.
Yes, that is part of the broader. So again, part of the broader. So there are plans for compostation in Israel, as you probably well know. But a lot of times the cost of transport, if you're not near one, and the separate transport is also an issue. And then because the cost mechanism is still not in place. So as I mentioned again, the instruments in terms of either increasing landfill tax or on the one hand, or subsidies on the other hand for such efforts are not currently in place. And I think that's something that Manoj did show that in the UK they do have support for efforts like that. And maybe we can hear more about that from Kevin, how that's actually felt on the ground in hospitals that have better separation schemes and also better access to either composting sites or waste to energy solutions, which in Israel basically don't exist either. So.
Kevin or Manoj, would you like to address it, or should we go forward to another question? Okay, Ranan, any further comments on this question, or?
No, thank you. And I really enjoyed this wonderful online meeting. So thank you.
Thank you. Anyone else? We still have a few minutes for further comments, questions. Oh, wait, I see you unmuted yourself.
Yes. Well noticed. I wanted to say something from my experience. It's not only, I don't have a lot of experience in food waste, but in the process and regulation, I think that there is maybe 3 major things that we don't have or don't have enough. It's a regulation policy. And after we have it, I mean, through all the areas, through all the food chain, when we will have the regulation, the policy, and then the education and training of everyone that is working in the food chain. Because I know from, for example, when I enter this role, or when we enter a new system like the cook chill systems, it requires a lot of education and knowledge for every worker, every professional, every role, because I'm feeling now that even the dietitian that are working in food service, and even we don't have enough the knowledge to do it properly. I mean, we have to share knowledge and to do special training. And after we do it, I mean, the regulation policy, the education and training, then we can enter it by audits. I mean, it's not enough to have a regulation. If I wanted that the regulation will be implemented and goes on regularly, I have to do audits about it in all the area and fields that I believe you know better than I do. And that is why we have to share knowledge and maybe even to do things together to bring it to the level of regulation and the awareness of everyone. Not only the Ministry of Health, there are many government ministers that have to be involved in it.
Oh, wait, I totally agree with you. And I want to even say further that what we saw in really more than a decade in trying to promote food waste reduction is that the first thing is the lack of knowledge and the unwillingness to hear about it. Very conservative places and institutions that even to come and say that, hey, listen, there is a food waste problem, you need to look at it. It's the first barrier. And when we go to places, and even if we, show the data and we talk about the problem and we talk about the ROI in terms of the economic ROI, environmental, social, and of course the nutritious, it's not enough. Oftentimes the conservative approach, and this is how we work. This is the way we do things. And that's how we will continue to work on these issues. It's the major barrier. And then after we are able to move from this barrier, then what you say is the next obstacles, the lack of legislation, the lack of knowledge, the lack of data. But I would say an optimistic view that we do have enough of data already to really solve in different places of the food supply chain the problem of food waste. But really, I think the first barrier is the conservative approach, the fact that people do not want to change the way that they operate and to learn new stuff and even to acknowledge that it's a huge problem. It's a huge problem, food waste, and from all the things that we talked from, the different perspectives. So, and it goes to institutional caterings, and it goes also to our, on our own personal behavior and consumption. We found 17 different reasons why people waste at their houses, and really, really easy steps that people can do in their house to change it. But the conservative place that this is how we do it, and why should we even change? And the sense that it's really bothering people to change. The psychological element is really big here. So I totally agree with you, but say that even the problem is a bit before in accepting to hear that there is a problem.
I couldn't agree more. But I believe we are in the right way, but we will need a lot of it's not just money. I mean, it's together many stakeholders to be together in this thing.
Yeah, it's about changing the way that system operates. It's totally not about the money. It's just changing the way that the understanding that the way that the system operated so far didn't lead to good achievements, and the fact that we throw 1/3 of the food that we produce, as Manaj started asking at the beginning of his presentation, means that the system is broken. No high tech would continue working when 1/3 of its operation is totally failure. So I think this is the basic perspective that we need to start from. But yes, we should be optimistic, and definitely the research that we have seen and the work that you have been doing is making me more optimistic that we have more data, we have more awareness, and that we are going towards change. And maybe all this could be a good way to say thank you and give you back the.
Well, thank you. I just want to say, I hope we don't need huge crisis in our food system for us to start thinking more seriously about this. I think we heard a note of that from Kevin, saying that with the food cost crisis in the UK has kind of served as impetus for considering more options for redistribution. And I hope that we don't have to see a global food crisis and a real situation where a lot of produce and a lot of different foodstuffs become exceedingly difficult to put hands on in the market, for us to start really understanding that we need to consider these issues much more seriously. So we know that in public policy, a lot of times windows of opportunity are only created by crisis, but I don't think we really need to achieve that. And in this case, lack of food and obviously, or even, just the difficulty in obtaining food is extremely severe crisis in human terms. So I hope we don't need to reach that point for us to take these issues much more seriously. So if there are no further comments or questions, I think we can finish a few minutes early. And I really, really want to thank again all of our partners on this path, and hope that we continue this cooperation, both with the NHS, with the Ministry of Health, with the support of our friends in the British Embassy and British Council. So thank you so much. Thank you to our research team, Tal and Sydney, Dr. Tal Golan and Sydney, and thank you to you so much, Michal, for serving as a very gracious and wonderful moderator for this event, and also very knowledgeable, I would say, and with a lot of hands-on experience. So although this was in virtual format, I really do feel that we got to kind of hash out the issues a little bit, and obviously there's still a long way to go. Yeah, that's it. Minaj, maybe last words to you.
Oh, thank you, Or. It's a fascinating collaboration with you, but it's just the beginning. But I just like to add one thing, though. It is really not that we are not in the crisis situation. We are in crisis, food crisis. out of 9 billion people, 1 billion go to bed without food. And just think of in the UK, 3 million children go to school without breakfast, proper breakfast. So that is hard, that is really a difficult. It's not that we don't have enough food. We do not know how to manage it, how to distribute it right way. So that's why it is our role as researchers to put these things in perspective in the right way so that it reaches to the policymakers and the policy we can influence it. So that's why it is really nice that the ministry is represented here, Kevin joined from NHS, so that these kind of events can really help each other to know and build a system which is not broken. And we all have a good, nutritious food when we need and how we need. Thanks a lot for your cooperations.
Thank you, everybody.
Thank
Thank
you.
you.
Thank you very much.
Thank you so much.